can't do this because I don't know what I'm doing. And, but, and I was like telling myself, I'm not doing this again. Like, I'm not doing this. I was watching TikTok and there's a video that popped up of this lady who pretty much said, y'all sat the F down and decided to just pretty much have one child. And the video really struck a chord with me. And as I was doing shorts today, posting on this same topic, I was like, let me talk about it, because she also left me a comment saying that she wished more women would be more transparent about their experience with childbirth, having a baby and all that stuff. And so I'm going to be very transparent because I feel like maybe this is important. I'm not trying to scare anyone, but this is just my experience. So pretty much why I decided that I was one and done. I'm not saying never, ever, 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 because things can happen. But I really pretty much sure me and my husband were like, yeah, I don't think we're going to do this again. So, yeah, I have a 9-year-old now, and he's the best thing ever. I'm not saying that childbirth is horrible. I'm not saying that bring a baby to this world is a bad thing and all this stuff. This is just me speaking really honestly about my experience and saying that this is a reality. Anyway, all right, I'm just going to get into it. So a few of the reasons why I decided to have one child is because the whole experience really traumatized me. One of the first things that traumatized me was the amount of bleeding that I experienced after having a baby. They gave me those diapers that you wear, and I found myself bleeding through them, like as I was trying to use the bathroom, because for the first 2 days I was bleeding a lot. And some women said they didn't bleed much, and some others said that they did bleed a lot. So it just depends. I was bleeding where every time I got up, I felt like I was squishing blood out, and it's just like, what the heck? That was there. The second thing had to do with my blood pressure kind of going crazy the first 2 days after giving birth. So they kept me in the hospital for extra days. And that was not fun because literally I wanted to get out of there. And I just wanted to go home, because I got induced, and the induction process was really uncomfortable and really painful because they tried everything on me. I was checked in around 5 p.m. and they tried so many different things to get my body to do its thing, and it didn't. So they jumped right to Pitocin or Pitocin, and this thing sped up the whole process where I was pretty much ready to push within like 30 minutes. And I'm thinking to myself, maybe you guys should have just given me that, because this thing, the pain sped up so fast. I became sweaty. I was shaking. I was shivering. I was erratic. And I was screaming for an epidural because my body could not handle the amount of pain that medicine, brought onto my body. So I was like, oh my God, telling my mom, like, please dab my head because I just can't do this. And I'm screaming. I'm like, I need the epidural. I need the epidural. Like, so the nurse was ready. Thank God. The doctor was ready. Thank God. But that pain was something. The other thing that really traumatized me is the pushing part, where you're pushing this. It felt like a bowling ball down your vajayjay, and the vajayjay, my son was very close to 9 pounds. And so pushing and feeling it feel like it's ripping, and it's like somebody putting alcohol, like rubbing alcohol around it, and that burning, I'll never forget it. And also I ended up ripping down there, so they had to stitch me up. And to this day, I have flashbacks sometimes randomly where I feel like the doctor is going in with the thread and pulling and stitching me up. And so that sensation sometimes comes up out of nowhere, and I'll have that flashback. And I'm just like, no, I'm not doing this, Breastfeeding was not good for me because I stopped breastfeeding within the second month because pretty much my son was not getting enough supply from me. And so they had to pretty much move him and tell me to move him to a bottle because I started getting bloody nipples. Because they were so dry and they were so sore and painful. And I had lactation specialists who were trying to help to a certain point, but the other times they felt like they were being pushy. And they kept saying, switch this position, go do this. And to me, it just became overbearing. And I was literally like, I can't even get myself together because I'm in so much pain. I can't do this, And they're just like this and this. And when one of the nurses, as I was going through this whole process, was rude to me and told me, do you want to breastfeed or not? And I was like crying my eyes out with my husband like sitting there next to me. It's like, I'm like, he was just like, she's trying, and just that rudeness really, I'll never forget it, because that's one of the times that a woman is going through so much. The least you can do is be kind as a nurse, The other thing was my son cried for almost 6 months, and we went to the doctors telling them this, and they were like, oh, try this and try that. Maybe it's his stomach. maybe it's this, maybe it's that, and they couldn't figure it out because my son was perfectly healthy. His numbers were so great when he was born, like he had no issues. And so we realized later that my son gets moody. He has this personality where one minute he's happy with everything you're doing, the next he's like his mood changes. So it's like it's kind of like a part of his personality. It wasn't a health issue. So me and my husband laughed so hard because literally we were like, oh, he's like me. He's really like me because I'm one of those people where I'm happy a lot, but there's moments where you just look at me like, what happened? Like, what's going on? And that's what he has. So it was funny. All right. The other thing was when I was staying home with my son so much and my husband was going to work, I found myself having thoughts that were not great. And this is hard for me. Those moments that I just wanted to get away from it all. Like I just was like, this is too much to have to take care of someone. It's too much. And I'm by myself. A lot of times, my mom-in-law did help a lot, but sometimes they had to go to work. So I just found myself really, really emotional, really like on the edge. And I just wanted to get away from it all because I'm like, I can't do this because I don't know what I'm doing. And I was like telling myself, I'm not doing this again. Like, I'm not doing this again. Like, wow. Even when we went for our checkup, the 4-week checkup, the doctor was like, so what are you guys going to do for birth control? And I looked at him. I was like, you don't have to worry about me. You don't have to worry about me because I'm not coming back here. I'm not. You're not going to see me here again. So 9 years later, like, yeah, I'm not back there. Okay. So I started having really thoughts that were just so dark. And I would just look at my kid like, I was like, I don't know what I'm doing. And this is too much. And it's too lonely. And I was waiting, like looking at the clock, like, is my husband off yet so he can come back home and so I can get a break? But I was not having good thoughts. And I just found myself not even enjoying some moments of being a mom, that early stages, because I'm like, this is too hard. This is like so freaking hard. But the one thing that I read, because I was reading a lot of stuff from other moms, watching a lot of social media, and one of the moms said that when you worry like that, whether you're a good mom or not, you're a good mom. Because there's moms that didn't worry about that. They didn't have those thoughts of saying, wow, this is too much, because they were just not good moms, So I was like, okay, I'm doing good. Kids are a blessing. They're wonderful. But the whole birthing and that thing is messy, and it's messy. So yeah, that's another reason. My pregnancy, though, I did enjoy being pregnant, which is weird. It was smooth until the end when my back felt like it was stuck, and everywhere I would stop and I'm like, oh, I need a break, I need to stand, I need to sit down because my back is stiff. And I didn't know that's when the baby's dropping and they're ready to come out, pretty much. Whew. The induction process was just really, really, really bad. Like, they tried so much stuff on me throughout the day. My sister was like calling me and saying, why are they doing all this thing? Why can't they just speed things up? Like, why are they putting you through this? And I'm like, I don't know. This is what the hospital wants to do. And so, giving me this medicine that sped up everything could have really helped me out to not go through that process. The anxiety that I had all the time, like, I literally was so anxious during my whole pregnancy. And I'm still anxious. And I just almost I was too anxious to kind of enjoy really being pregnant, even though I had a smooth pregnancy in that way, but I just was too anxious. And it just left me feeling like, wow, yeah, I couldn't do this again. And especially now that I'm in perimenopause, I don't know, guys. Like, I don't think I could do it again. I know women are built strong, we're tough, we can, but for me, sometimes I also feel that I'm good with one because I'm still living my life. I get to have fun, and it's really a fun stage now, and he's doing some stuff on his own, and it's good. And also I like that, they say that every time you have a child, it's like taking away something from you. So if you have like 2 or more, you're giving a lot each time, So for me, I was just like, I don't know if I want to give myself again. I'm realistic in that way. Like, I'm selfish. Like, do I really want to do that? Like, I'm working on myself, and do I want to put myself through that again and start over? I also want to say the weight gain thing, that wasn't my issue. Like, I lost most of the weight right after having him because breastfeeding for a little bit, and then my body just dropped all the weight. So I can't even blame baby weight for this. But anyway, so that was awesome. So that my body, I was okay. Like, I wasn't my worst thing, you know. It was all the other stuff, you know. So my mom-in-law was a savior. She helped me so much the first couple months and for us to adjust. Otherwise, I also believe that if my mom-in-law was not there, our marriage would have never worked out. We would have been divorced because literally me and my husband were looking at each other like, oh, who's going to wake up in the middle of the night? And we would have been arguing about this and that. You know, he's a patient person, you know, and sometimes when I'm going like, you know, he's just like looking at me and it's like, okay, what do we need to do? Like, so I would always, I said that having a child maybe would have messed up our marriage if my mom-in-law was not available. So, yeah. All right, guys. I've talked too much. Bye.